Hello, everyone. Our GRP topic for bio-nanotechnology will be over electrospun nanofibers with drug delivery, and it will be presented by Andrew Lozano, Stephen Juarez, Hong Lee, Armando Galvan, and Manuel Tienda. Okay, so for centuries, mankind has turned to a variety of methods to close wounds, which may not properly be able to heal on their own. While most practices of mending wounds in today's medical field have been proven to be reliable, the methods being used require the need for a skilled professional and numerous hours of treatment to ensure success. The need for innovation in this field of practice is crucial to first responders who may not have a licensed professional available to treat a patient's wounds. Okay, so a brief history in treating wounds in a quick manner. Some of the earliest examples of wound closures can be seen on this picture to the left, where East African tribes would use the heads of army ants to close cuts. They would use them because they had a strong bite force, but obviously it wasn't a long-term solution. The picture in the middle are what's called butterfly strips, which are commonly used today and are used to temporarily close wounds. And the picture to the very right are what's called wound closure strips, which are the latest alternative to stitching, but are not as effective. All three of these methods are relatively quick ways of closing wounds without the need for a medical professional to be present. And there's still a lot of room for improvement. Okay, so with the introduction of electrospun nanofibers, this field may be open to vast improvements in regenerative medicine. These nanofibers will be fabricated by a simple coating, blending of polymers / bioactive molecules which contain nanofibrous scaffolds that can provide the necessary biological signals to respond to the environmental stimuli in the human body. These nanofibers in particular are being used to create the stimulant specific regenerative events at a molecular level to generate healthy human tissue and aid in the healing process. This new method of regenerative medicine will be an evolutionary step forward in the treatment of most wounds and can perhaps eliminate the need for a trained surgeon to be present. Okay, so possible applications. It could be used to repair things such as nerve tissue, skin, cardiovascular tissue, or even bone. As you can see in this chart, here are some of the different structures.
Hypnosis of colon. An open wound can be lethal to any person. Although there are currently different methods to close and cure wounds. The most common treatments in present time are not 100% safe since multiple health risks can appear even after the treatment. The most common method for any open wound is usually stitches. The stitches can cause health risk problems that are infections, wounds can reopen, and deep scars that can permanently stay on the human body. An example of an infected wound caused by the stitches is shown on the image provided. This obviously can cause health risks, and it can be more costly to the patient since it will require more treatment just to cure the infection. Cyanosis of pollen continuation. Although there is different methods of closing wounds, that is a little bit different from the regular stitches, which are dissolvable stitches. Dissolvable stitches are mostly used for inside wounds or surgeries than for the wounds on the surface. Major problems can still occur with this type of process, such as infections. Stitches can emerge outside the body, and as regular stitches, this type of treatment takes long periods of time, which can eventually cause even more problems, as that one problems I previously mentioned, and even more in the future. Disposable stitches are a little bit different than regular stitches since they're meant to dissolve inside the body. Although some don't 100% dissolve and emerge. An example of these is in the image provided.
Solution to the problem. With nanotech becoming a more promising concept of technology with pharmaceutical application, electrospun nanofibers show great potential in many biomedical applications, such as tissue engineering, drug delivery, regenerative medicine, and wound healing. When dealing with electrospun nanofibers, the human skin can be placed in a less stressful healing environment while full thickness skin regenerates. As proven through original or traditional treatment options, every time the skin deals any damage, it is never replaced at the original full strength or thickness. Electrospinning auspiciously creates nanofiber yarn, which can later be used as surgical sutures. Facilitating wound healing, as mentioned before, can also help reduce inflammation and prevent on-site infection and relieve any pain that is present. By also presenting greater strength in the tensile and knot, it also presents cell growth and minimal toxicity compared to commercial sutures. In addition, not only could the nanofibers work with skin, but with muscle tissue as well. In some instances, there isn't an open wound, but superficial one. Wherever this is the case, the nanofibers can enable the production of biometric nanofibrous material from a natural and synthetic polymers with relevant biological features. Some great examples of this would be first degree or up to third degree burns or even scarring. With any type of wound, open wound, or any injury in that matter comes a great deal of pain, even after medical treatment. So with the use of the electrospun nanofibers, drug and wound dressing delivery can be controlled and released, which can benefit the stress the skin or the body is experiencing at any time during the healing process. Major roles of wound dressing include maintenance of wound hydration, absorption of excess wound exudate, and minimizing any wound trauma. In other words, having the nanofibers mimic the porous topography of natural extracellular matrix, or ECM for short, can be controlled with the release of encapsulated drugs for infection or growth factors. This method can, of course, speed up the recovery at a much more faster pace, but also gives out a more secure outcome while also being only being aimed and to trigger release of these antimicrobial agents in an infection, if any infection occurs. Besides the drug delivery, the electrospun nanofibers would act as microbial barriers, preventing any invasion of outside microbials. This can potentially enhance diabetic wound healing at a higher recovery rate with more success, and also with the use of the nanofibers combined with stem cells, the regeneration of tissue, blood, vessels, bones, cartilage, and even skin can all share a fast and effective treatment. Overall, skin wounds may vary from superficial, partial thickness, or full thickness. However, with the use of nanofibers, we can provide excellent therapeutic agents with local delivery, wound healing requirements, regulate skin cell behavior, fabricate sutures, dressings, and even dermal and epidermal substitutes for skin wound healing.
So nanofibers has demonstrated great benefit in quite a variety of areas, especially in medical applications. But some challenges need to be addressed before speeding the process of the development of electrospinning and nanofiber. They are large-scale manufacturing and the safety aspect of electrospinning. So in order to produce the large scale of electrospinning, the major challenges associated with the mass production of electrospun fibers include the low output per spinner rate, blocking of the spinneret tip, the interjet interference, the recovery of the vaporized solvents involved in the process, and fiber alignment over the large area of sustainable thickness. Also, there is a limit on the fit rate per nozzle, and higher rates might just result in dripping the solution from the nozzle, especially if the nozzle is placed in the middle. This is due to the insufficient electric field experienced by the nozzles, which results in the inadequate drawing of the solution. So another factor that could limit the development of electrospinning is safety in use and maintenance. The main danger of electrospinning comes in the high voltage required for spinning the nanofibers, typically more than 10 kilovolt. And the solvents used in preparing the solution. In recent years, many commercially available electrospinning setups have safety features built into them, which has an exhaust outlet for expelling solvent vapors and an automatic cleaning mechanism for removing any clogged solution at the tip of the spinneret. This eliminates the need for the user to manually clean the clogged spinneret tip and also reduce the exposure for the user to the solvent vapors. About the solvent used in the electrospinning process, this particular issue is highly important not only for the safety reason during the fabrication, but also for the final products. As solvent residues might be trapped inside the electrospun nanofibers, accurate control over the solvent residues become crucial in the case of large volume solvent-based electrospinning for biomedical and pharmaceutical applications.
In conclusion, Electrospun nanofibers are very useful technology derived from nanotechnology that can be applied in many fields, but mostly in the medical field. Its application in the medical field is about taking care of potentially dangerous wounds that can lead to death. But it would heal the gown at a very fast speed, and also it will prevent the gown to get any kind of infection. Without any doubt, this new technology is going to be a considerable leap in the medical field. But before implementing this technology, there are some challenges that need to be addressed. Some of those challenges could be the large scale manufacturing, which is one of the most important because if there is some production, many medical centers will be lacking of this at the beginning. But there are many more positive factors. The positive factors are that it would decrease the patient's time spent in the hospital, and that's gonna lead to an increase of available beds for patients that will need one in the future. The most important fact is that it will save many lives. Many people can be treated using this technology. And here are the references used for our GRP for both the report and this presentation. You're more than welcome to take a look at them. And here we have the questions section. You're more than welcome to drop any questions that you may have from this presentation in the comments section. And I really hope that you guys liked our presentation, and thank you for your time.